So hello, and we welcome you to this session on refractive surgery for myopia. We'll be talking about it live, and we'll be taking some questions that you might have on this. I'm Dr. Tushar Grover. I'm a medical director and a consultant in cataract, cornea, and refractive surgery at Vision Eye Center. So today we've taken this topic up because there is a lot that people want to know about it. There is the prevalence of myopia, as you might have heard, is going up tremendously. People are, a lot of people have minus power now, and some of them have a low power, some of them have a mid-level, moderate power, some have high powers, and everybody wants to get rid of their glasses. Not many people are happy with their glasses. Everybody wants a solution for this problem. So we'll be talking about that today. We'll be talking about the different options that we have for each of these individuals. Each category, there is usually a different surgical procedure that can be undertaken to get rid of power in these different kinds of individuals. So whatever your power is today, fortunately, surgical advancements have reached great heights, and for that reason, we have quite a lot of options, and we'll just help you understand a little better about it. We'll try and find out what your power is, what would be the best solution for you, and we'll help you guide on that today. So we can start with some questions. We already have some questions that have been asked, and I'll be taking those up, and we'll answer in the form of different questions so that you get a better idea of what we would do in each case. Okay, so we have a question already. The question is that I have a prescription of minus 1.5 in both eyes, and my corneal thickness is 530 and 532. So a very well asked question with all the details that are available. So for a power of minus 1.5, it is not a very high power. It is a relatively low power. And in this case, you essentially have two options that are extremely good for you. One is a surgery called PRK, which is also known as photorefractive keratectomy. This is a very, very good surgical procedure for low powers. And this is something that I would recommend for you. The second option that you have in this case, in a power of minus 1.5 with an otherwise overall healthy cornea, is to undergo LASIK, because LASIK also gives you extremely good visual outcomes. So now I've spoken about two surgeries. I've spoken about PRK and I have spoken about LASIK. So you would want to know what is the difference between these two and which one, and based on that, be able to take a decision on which surgery would be right for you. Both the surgeries, PRK and LASIK, give you similar visual outcomes in the long term. So the quality of vision that you would get is going to be the same in both the cases. The difference is in the comfort. So soon after the surgery, the next day after surgery itself, you are going to be quite comfortable if you undergo LASIK. You will be seeing quite well. You will not have pain the next day also. You'll be extremely comfortable. Visual recovery is quicker as well. Whereas in PRK, you would have a little more discomfort on the first few days after surgery. You might have some pain, you might have some discomfort, a little bit of blurring in the first week of surgery. So the visual recovery and for you to get comfortable takes a little longer with PRK surgery as compared to LASIK. But subsequently, long term, your vision is going to be the same in both eyes. So it'll be good to discuss this with your treating surgeon, and based on that, take a decision and finalize what surgery you want to undergo for this. Okay, so the next question is, what are the causes of refractive surgery for myopia? So I think a more appropriate question here would be, what are the causes of myopia for which you are undergoing refractive surgery? So myopia, one of the most important factors is genetic. So if you have glasses, if you are wearing minus powered glasses, your children are also much more likely to have a glass power. This is in your genes, and this is not something that anything can be done about as such. But again, having a glass power, having a refractive error is not a problem. Your eye is still healthy. You are still seeing well with glasses. So that is not an issue to worry about. Also, excessive screen use and excessive indoor activities are associated with a higher myopia incidence. So I would recommend that, if you have children, allow them about an hour of outdoor activity every day. Allow them to engage in some sports, engage in some running or playing, so that the chances of power and the amount of power that they get are going to be lower. Okay. So another important question that we have now is that my glass power is increasing. Is there any way to reduce the power of glasses? Yes, there is, of course, a way to reduce the power of glasses, but we would have to wait for your power to stabilize. If your power is still increasing, it is likely that you're still quite young. You're in the age group of teens, or maybe, late teens, or 19, 20. So if your power is increasing, it's always better to wait. And only then we should consider a surgery to get rid of your glasses. There are some drops available now which reduce the amount of increase that happens in your power, and that you can discuss with your treating ophthalmologist. And if the ophthalmologist considers it appropriate, after examining you, they can give you some drops which helps reduce that increase that is happening in your power. But your power will not go away with that. Your power can only be taken away by surgery, and for that your power needs to have stabilized first. Okay. The next question is from Sehaj, who says, I have myopia. When I had my eyes checked, the power was 1.5, minus 1.5 in my right eye and minus 2 in my left eye. However, due to the wrong lens power, both eyes ended up being minus 2.5. I'm considering LASIK for this. Is it safe to undergo the operation? Yes, it is. As long as your cornea is healthy, the thickness of your cornea is adequate, even if your power has ended up being minus 2.5 now, you can undergo LASIK. And in fact, LASIK would be an extremely good procedure for you, provided your power is stable now. And over the last 6 months or a year or so, it has not increased too much, or it has not changed too much. And provided you are at least over the age of 18. Okay. So the next question is, myopia के लक्षण क्या हैं? तो मायोपिया में जो हमें प्रॉब्लम होती है वो ये होती है कि दूर का साफ नहीं दिखता. तो कई बार बच्चे ये कंप्लेंट देते हैं कि मैं जब पीछे बैठता हूँ या पीछे बैठती हूँ तो मुझे बोर्ड साफ नहीं दिखता, या मुझे दूर के छोटे अक्षर साफ नहीं दिखते. तो ये एक बहुत कॉमन लक्षण है मायोपिया का. सबसे पहले इसी कंप्लेंट से हम डिटेक्ट कर पाते हैं मायोपिया. और इन लोगों को, बच्चों को या एडल्ट्स को जिनको ये लक्षण है, उनको चश्मे की पावर दे दी जाए तो उनकी नजर बहुत अच्छी हो जाती है, बिल्कुल नॉर्मल हो जाती है. Any other questions that we have? Okay, so again, another important question is that I have a power of minus 5 in my right eye and my left eye has amblyopia, also known as lazy eye. Can laser surgery do anything to address this condition? Okay, extremely good question. So you have a power of minus 5 and the other eye has amblyopia as well. So if I'm sure your left eye probably has a higher power than the right eye if you have amblyopia in that, or you have any other associated condition like squint. So whatever power you have can be corrected using LASIK. However, the visual reduction that you have in the left eye, the slight dysfunction that you have in the left eye with glasses also is going to persist after LASIK also. So LASIK is not a treatment for amblyopia, but whatever vision you are getting with glasses in that eye, you will be able to get without glasses, because you'll be able to get rid of glasses using LASIK surgery. Any other questions? Okay, the next question is, my name is Vikesh. I have a prescription of minus 1.5 in both eyes and my corneal thickness is 530 and 532. Which surgery would be best for me? So again, in this case as well, both PRK and LASIK are extremely good options. Both give you extremely good visual outcomes in the long term. The only difference is that PRK, you will have some amount of discomfort, slight pain for the first few days after surgery, whereas in LASIK, your visual recovery is going to be much faster. Your symptomatic improvement, which means the time taken for you to get comfortable, will also be much faster. So that again is something that you should discuss when you are planning the surgery, and discuss with your treating surgeon, and then take a call on which one of these two you want to go for. Okay, another important question is, क्या मायोपिया बढ़ने से रोकने के लिए कोई व्यायाम या योगा है? तो साइंटिफिकली व्यायाम या योगा का पावर बढ़ने से कोई प्रूवन रिलेशनशिप नहीं है. जो चीजें इंपॉर्टेंट हैं जो मैंने आपको बताई वो ये कि बचपन में थोड़ी आउटडोर एक्टिविटी ज्यादा हो। अगर बहुत ज्यादा स्क्रीन यूज बचपन में हो रहा है, बहुत ज्यादा पढ़ाई हो रही है, आउटडोर एक्टिविटी बिल्कुल नहीं हो रही, खेलना कूदना बिल्कुल नहीं हो रहा, तो पावर बढ़ने के थोड़े ज्यादा चांसेस होते हैं। तो इसीलिए अगर आपके बच्चे हैं जो कि सारे टाइम स्क्रीन पे बैठते हैं या फिर एक्सरसाइज नहीं करते, उनको थोड़ा इनकरेज करिए कि रोज दिन में 1 घंटा बाहर जाएं, कुछ खेलें, वॉक करें। इन चीजों से पावर बढ़ने के चांसेस थोड़े कम होते हैं, और अगर पावर बढ़नी है तो कम बढ़ती है कंपैरेटिवली। Okay. The next question is, can myopia worsen with time? Is there any underlying cause for it? Okay. An extremely good question again. Myopia does increase in the first few years of age. So up till the age of about 18, 19, myopia does tend to worsen. After that, it stabilizes. Why is myopia happening? So if you have a minus power, that means your eyeball, the size of your eye is longer than an average individual. So if you have a power of -3 diopters, that means your eyeball is longer by about 1 millimeter as compared to an individual with zero power. So that is why myopia develops. And that is the underlying cause for it. The underlying cause is that your eyeball is longer than the others. That is why you have a minus power, and that is why you need a lens to correctly focus the light onto your nerve cells. The causes for this, again, like I said, is most commonly genetic, and excessive indoor activity, excessive screen use in childhood also worsens the progression of myopia. Any other questions? ओके, अगेन अ गुड क्वेश्चन इज, क्या लंबी स्क्रीन टाइम मायोपिया को बढ़ाती है? मैं रोज कंप्यूटर पे काम करता हूँ. गुड, सो वेरी नाइस क्वेश्चन. आप अगर 21-22 साल की उम्र से ज्यादा हो तो लंबा स्क्रीन टाइम करने से आपकी पावर नहीं बढ़ेगी, आपको स्ट्रेन होगा, आपको ड्राइनेस डेवलप होगी, हेडेक्स हो सकता है, आई पेन हो सकते हैं, क्योंकि आपकी आंख की मसल्स कॉन्स्टेंटली स्ट्रेन कर रही है. तो ये सब दिक्कतें होती हैं स्क्रीन यूज की वजह से. पर एडल्ट्स में स्क्रीन यूज करने से पावर नहीं बढ़ती, क्योंकि उनकी पावर ऑलरेडी स्टेबलाइज हो चुकी होती है 18, 19, 20 साल की उम्र के आसपास. पर बच्चों में, अगर बच्चे सारे टाइम कंप्यूटर पे इस्तेमाल कर रहे हैं, बिल्कुल आउटडोर एक्टिविटी नहीं कर रहे, तो फिर पावर बढ़ने के चांसेस ज्यादा होते हैं. तो इसीलिए बच्चों को एनकरेज करें कि थोड़ी आउटडोर एक्टिविटीज करें और लंबे समय लगातार स्क्रीन इस्तेमाल ना करें. Any other questions? Okay, what are the side effects of refractive surgery? So again, a very important question. No surgery and no surgeon should ever say that any surgery has 0% risk or 100% safety. Any procedure that you undergo on your human body involves some risk. Having said that, any form of refractive surgery, whether it is LASIK, PRK, or ICL, are some of the safest surgeries that exist on the human body. With the technologies that we have today, chances of major complications, major side effects are extremely, extremely low. But there are potential complications. So complications like infection can happen with any surgery. There is that complication of developing weakness in your cornea at a later stage because of LASIK, and various other complications that are potentially possible but extremely rare in today's times. Okay. Is nutrition and diet important for myopia? Are there any special foods that help improve eyesight? Okay. So for good eye health, yes, diet and nutrition are important, because a healthy eye can only live in a healthy body. And therefore, if you have a healthy body, you're eating well, having a good balanced diet, having a good amount of green leafy vegetables, substances that are rich in vitamin A like carrots, your eyes are likely to be much more healthy. But does it have a direct association with myopia? Scientifically, there is no evidence that there is. So we shouldn't link diet and nutrition necessarily to myopia, but we should link it to overall eye health. Okay, good question. The next question is, क्या सर्जरी मायोपिया को हमेशा के लिए ठीक कर सकती है? जी, तो बेसिकली जो भी सर्जरी करी जाती है, चाहे लेजर किया जाए लेसिक के दौरान या फिर आईसीएल सर्जरी करी जाए, जिसमें आपके आंख के अंदर लेंस बिठाया जाता है, दोनों सर्जरियों का ट्रीटमेंट परमानेंट होता है. जो लेजर किया गया है वो लेजर परमानेंट है, वो लेजर का असर नहीं जाने वाला. और ICL में भी जो आपका आंख के अंदर लेंस डला हुआ है वो लेंस उसी पावर का रहेगा। अगर किसी को किसी कारण से वो लेंस निकालना पड़ता है, निकालने की जरूरत है, तो निकाला जा सकता है। बट इन सब से जो आपका मायोपिया है वो हमेशा के लिए ही ठीक होता है। पर कुछ चीजें पता होनी चाहिए कि अगर आपकी मान लो पावर स्टेबल नहीं है, अगर आपकी पावर जो जो ठीक करी गई उसके बावजूद और पावर बढ़ गई, पहले मान लो -3 थी -4 हो गई, तो वो जो -1 और आ गई वो सर्जरी के बाद भी आ सकती है। इसके अलावा जो आपको 40 साल की उम्र के बाद पास का चश्मा आएगा, जिसको मायोपिया नहीं, जिसको प्रेसबायोपिया बोला जाता है, वो आपको लेसिक सर्जरी के बावजूद आएगा, क्योंकि वो एक अलग मैकेनिज्म है, वो अलग वो आपकी आंख की मसल्स जो कमजोर होने लग जाती हैं 40 के बाद, उसकी वजह से होता है। और आगे चल के और उम्र में जब आपको कैटरैक्ट बनने लगता है, सफेद मोतिया बनने लगता है, तब भी आपकी पावर थोड़ी बहुत बदलती है और उसमें आपको ऑपरेशन की जरूरत होती है। वो सारी चीजें वैसी की वैसी रहेंगी। आपको आप लेसिक कराएंगे तब भी आपको 40 की उम्र में पास का चश्मा लगेगा, तब भी आपको मोतियाबिंद जब आएगा किसी भी उम्र में तो उसका ऑपरेशन कराना पड़ेगा। तो ये अलग प्रॉब्लम्स है। बट लेजर जो हो रहा है या जो आपकी पावर ट्रीट हो रही है वो परमानेंटली ट्रीट होती है। ठीक है। The next question is, how can I find the right eyewear or contact lenses for managing my low myopia? So important that first you've gotten your power tested from a reliable place. Ideally, you should have seen an ophthalmologist, an eye doctor, not just an optometrist in an optical shop when you got your power checked, so that it can be verified that your power is correct. That is the most important thing. Apart from that, when you're getting your eyeglasses made, it's important that you get it physically from a shop rather than order it online, because there are a lot of measurements that need to be taken. There is something called as interpupillary distance, for example. That is basically the distance between the center of both your eyes. That distance is different in each individual, and that difference needs to be measured so that you get the right frame and the placement of the lens is correct. So that is why it's extremely important to get all these things checked. For contact lenses, again, there are various companies. It doesn't matter which company, most of them are quite good, but you have to take the right care. You have to make sure that you change the solution every day, clean the contact lenses every day with the solution, clean the case every day. All these things are very important, and make sure you never sleep with contact lenses on. So these precautions are extremely important. Okay. The next question is, when should I schedule an appointment with an eye doctor if I suspect I have myopia? The answer is as soon as possible. If you have myopia, it means that you're not seeing clearly. You're not able to uh, effectively and clearly manage your routine activities. So you should definitely see an ophthalmologist as soon as possible, so that you can be given the right power correction. If you don't want to wear glasses, you can be given the option of refractive surgery such as LASIK, and it can be corrected. Why do you want to live uh, in a world where you're seeing blurred when you can see clearly? All you need is a small glass prescription or a surgical correction to treat your myopia. Okay, the next question is, क्या सर्जरी मायोपिया को हमेशा के लिए ठीक कर सकती है? Yes. So मायोपिया को सर्जरी परमानेंटली ठीक करती है। आपकी जो पावर है उस टाइम पे वो पूरी तरह करेक्ट हो जाती है किसी भी सर्जरी में। ये लेकिन मालूम होना चाहिए कि ऑब्जेक्टिव सर्जरी का ये नहीं है कि आपकी पावर 0.00 डायोप्टर होगी, क्योंकि आप अपना फोकस भी जब दूर से पास की तरफ चेंज करते हैं तो आपकी पावर फ्लक्चुएट करती है थोड़ी। ऑब्जेक्टिव सर्जरी का ये होता है कि आप अपनी रूटीन एक्टिविटीज में बिल्कुल कंफर्टेबल होगे बिना किसी ग्लासेस के। और आगे चल के, जैसे मैंने बोला, आपको 40 साल की उम्र के बाद पास का चश्मा आएगा, और कभी जब भी आपको मोतियाबिंद कैटरैक्ट होगा वो होगा। तो ये सब चीजें अलग हैं, वो तो होनी ही है। बाकी आपका जो पावर है वो भी स्टेबल होना बहुत इंपॉर्टेंट है, ताकि आपको आगे चल के दोबारा पावर ना आए। Okay, the next question is, can low myopia be hereditary? Should I be concerned about my children developing it? Yes, so low myopia is hereditary. Any form of myopia, there is a genetic component involved. So if you have myopia, it is quite possible that your children will also develop myopia. But I don't think you should be concerned about it. Myopia is something that is very easy to treat. All you need to do for a child is to give them the right glass prescription so that they can see clearly, so that their visual functions develop well. So I don't think you should be concerned at all. The only thing you should do is get your child checked as soon as possible if you yourself have myopia, because myopia does have a genetic component. Okay. Do we have any other questions today? Okay. The next question is myopia बढ़ने से बचने के लिए क्या precautions लेनी चाहिए? So again, very good question. For children, extremely important कि दिन में कुछ देर थोड़ी सी आउटडोर एक्टिविटी करें. 1 घंटा कुछ खेलने जाएं या भागने जाएं, वॉक करने जाएं, तो इन चीज़ों से पावर कम बढ़ती है. दूसरी चीज़ जो इम्पॉर्टेंट है वो ये कि स्क्रीन यूज लंबे समय एक्सेसिव बच्चों को ना करने दें, क्योंकि उससे भी पावर ज़्यादा बढ़ती है. तो बस ये 2 चीजें करिए आप. Okay. Do we have any other questions? Okay. So now I think we've concluded this live session and taken up all the questions that we were asked. So just to sum up, myopia has a lot of options now for correction. So whether you have a low power of say -1, -1.5 diopters, a moderate power of -3, -4, -5 power diopters, or you have an extremely high power of say -9, -10, even up to -15, 20. Some people have extremely high powers. All of these powers can now be corrected because we have different surgical options for each of these grades of myopia. So if you do want to get rid of glasses and you have myopia of any severity, of any grade, it can be corrected. So there is really nothing for you to worry about. Of course, discuss with your ophthalmologist what is the right option for you and know the benefits and risks associated with each of these surgeries. So thank you again for joining us today. It was really nice to interact with all of you for this live session on refractive surgery for myopia. If you have any questions or if there is any other topics that you would like us to take up, please do share in the comments box, and we'll be happy to take them up in the subsequent session.